Okay.
It was kind of pictured in one way. There was a little bit, but it wasn't full thing. Because I looked it against today and I couldn't find it.
Is it better to take this way to, or whichever is?
That way cuts your head off a little bit, so probably this. Like that. I can sit back.
In YouTube it doesn't. Yeah, just see if you can.
Yeah.
There, I can get, yeah, you're all in, yeah.
Okay. Let's start with definition of stroke. So how do you define stroke?
Loss of blood or oxygen supply to a certain area of the brain.
So when I mean definition of stroke, I mean a clinical definition. Patient don't come to you and say, oh, I've got reduced blood flow in this, that. That's not how patient will come. So how will the patient come and say to you? So in very simple term, I want you to know the WHO definition of stroke. So what is the WHO definition of stroke?
Is it like permanent neurological deficits after like a vascular episode or like damage or?
It's partly true, not yet. So I will say there are 1, 2, 3, 4, 5, 6 important things you have to know to define stroke. So first of all, it's a sudden onset or acute onset. Okay. A lot of neurological disorder will present, they will have different type of presentation. Key of stroke is sudden onset. 1 minute you are fine, next minute you are unwell. Okay. So sudden onset. And obviously, if it is it's a neurological deficit will be there, otherwise it won't be a neurological disorder. So what type of specific neurological disorder you get in stroke? Please, what type of specific neurological disorder?
Ischemic injury.
Yeah, but the patient won't come to you and say, I've got ischemic injury or I've got hemorrhagic injury. So what will the patient present to you? Confusion can be, but it's not a common presentation. What would be the common presentation?
Drooping.
So it's a focal neurological deficit. Unlike confusion, it's a global deficit. That's not a common presentation. Yes, it is possible, but common presentation is focal neurological deficit. Why focal? Why not go global normally?
Because it depends on the area of brain tissue that's been damaged.
Of course, it depends on. So why it is always most of the time focal? Because when we say about stroke, it's mainly arterial stroke we are talking about. If you think of the artery, most of the artery they supply one side of the midline. Okay, most of the artery, which is exception. Jack, which is exception?
I want to say the middle cerebral artery.
Middle cerebral artery is on one side of the midline.
One of the communicates in?
No. Communicating is not important. Like that is not, they don't supply that much of the brain. So which artery supply both sides of the midline?
Vertebral.
Vertebral still one side. Basilar. Basilar supply. So if it is basilar, the symptom will be different. But commonly it is focal. If you think of venous, that's different. That's some vein, most of them they get tributaries from both sides. So you cannot apply this definition to venous stroke. Arterial stroke, mostly focal. That's why it is focal, because it supply one side of the midline. Focal neurological deficit. What is the number 3? Vascular in origin. So when we say stroke, it's the pathology where the process is not starting in the neuronal tissue. It is happening because the blood flow or the blood supply which is supplying this neuronal tissue is compromised, and that's why the neuronal tissue die. There are other disorders where the neuronal tissue itself is damaged. Blood flow is okay. But when the blood flow is damaged, causing damage to the secondary effect to the neuronal tissue, that will result in stroke. So it's vascular in origin. Again, patient won't come to you and say, I have got a problem with the neurological deficit, I cannot move because I have got some vascular problem. Will the patient come and tell you? I won't be here to do the clinical teaching. So how would the patient tell you? How would you have a clue?
Sort of a FAST acronym, so you see unilateral weakness on the side.
No. How would you determine that it could be vascular in origin from history?
Check the patient notes might have a high blood pressure.
So they ought to have vascular risk factors. We'll come to that. What are the vascular risk factors? We'll go into detail, okay, about vascular risk factors. Number 4. Either symptom is lasting more than 24 hours. So you had the symptom, it's lasting more than 24 hours. Or would it be stroke even if the symptom is lasting less than 24 hours? Okay, so previously we'll come to the history. So in short, it could be still stroke if the symptom has lasted less than 24 hours. How? If we can demonstrate that there is damage of the brain tissue. If there is damage of the brain tissue, irrespective of time, it's a stroke. Okay? So if you can demonstrate damage of the brain tissue, irrespective of time, even if your symptom has lasted for 5 minutes, and we demonstrate that there is damage of the brain tissue, it's a stroke. Okay? And finally, symptoms in stroke are usually negative. What do I mean by that?
Like loss of tone, loss of speech.
Very good. So in stroke, you get loss of movement, loss of sensation, loss of ability to see, loss of ability to remember, loss of ability to have balance. Okay? So it's a negative symptom. Emily, let's stop here. I'll go in detail.